Hi everyone, thank you for joining us. This is the Labor Occupational Health Program, Young Worker Health and Safety during the COVID-19 pandemic webinar. This is a two-part webinar, so be sure to tune in for the second part as well. My name is Yassine Khan and I am joined by my colleague Alejandra.
Hi, I'm Alejandra Domensain. LOHP's mission is to promote safe, healthy, and just workplaces, and also to build the capacity of workers and worker organizations to take action for improved working conditions. So just to give you a snapshot of some of the things that LOHP does, this is from last year. We trained, over 2,000 workers in different health and safety topics in different industries. We also trained community members and students and health professionals, as well as worker leaders, so that then they are ready to teach others. And we train employers so that they know their responsibilities to protect their workers. And we've been around for about 45 years. So some examples of training that we've done recently. These pictures are from a 3-day leadership training that we did with workers that work at Tesla in the Fremont plant, as well as United Auto Workers staff members who were supporting them. And so our training was really focused on problem solving some of the unsafe conditions they were facing and what they could do about it. These are trainings that we do often with domestic workers. And so on the left is a training that focuses on green cleaning, or how to clean using non-toxic products that protect workers' health. And then on the right, you see some images that are from training that we do about ergonomics. So how people can use the position that they work in and their movements so that they don't have pain at the end of the day. Here you see a picture of some day laborers on a street corner. And so we worked with a street level health project to design an educational program based on realistic scenarios with pictures that we took with the workers. And then this is one of the staff members now who we train to do the outreach on the street corners with day laborers about health and safety issues. And lastly, this is a project that we did in collaboration with SEIU, USREW, a union that represents janitors, among others. And so they had trained worker leaders, or promotoras, to be educators about sexual harassment in the workplace. And so we developed this curriculum that was based on scenarios that they scripted and they acted in. You can see the filming process here. And then the worker leaders are now going to be the teachers of this new program on sexual harassment.
And in addition to the programs that Alejandra was just talking about, we also have a young worker program. And so within that, we have a train the trainer program where young folks are trained to then train their peers about workplace health and safety and workers' rights. So that's you see a photo of that on the left. And on the right-hand side, these are pictures from our Young Worker Leadership Academy, which is an annual program that we run where students that are in high school can apply from around the state in teams of 4 to come up to Berkeley and spend days with us and learn all about workers' rights, occupational health and safety, how to advocate to make sure that your rights are being respected and met, and sort of what to do if that's not the case. And so once they attend the academy and spend those 3 days with us, then they go back to their home communities and do a project during the month of May, which is Safe Jobs for Youth Month. So Safe Jobs for Youth Month is a public awareness campaign, which is also annual, to raise awareness about the fact that young workers are almost twice as likely to be injured as workers that are over the age of 25. So we have a poster contest here. You can see the winning poster from this year in this ad. And you can also follow us on Instagram at youngworkers_CA, or go to our website, which is youngworkers.org, for more information about Safe Jobs for Youth Month.
Today we're going to cover a couple of things. First, we're going to do a very quick review review of COVID-19 and how, it's going to look in the workplace. We're going to cover that too. And intersectionality and workplace health and safety, and in particular, how it may apply for youth. Okay, so let's start with a review of COVID-19. Think about the question that I'm going to ask, and then we will go over the answer. So first, getting the coronavirus is very similar to getting the common cold. So do you think this is true or false? Okay, so if you're thinking true, it is the case that the coronavirus is actually related to some other coronaviruses that cause the common cold, among other respiratory illnesses. However, the reason it's called COVID-19 is because this is a new variety of the virus that actually was first detected in 2019. And so it's very different than the common cold in many important ways. One, the virus is more deadly, it's more contagious, and you can infect others even if you don't have any symptoms. There's no vaccine for it yet, and there's no herd immunity, so we're a lot more vulnerable to it than other viruses. And so here's a little chart that tells you some of the ways that the flu and COVID-19 is different, as you can see. An infected person is more likely to infect others, a lot more. The incubation time is longer, so that means that you may have it for a long time and be infectious before you even know it, or you may never have symptoms and you never knew you were infected. Also, a lot more people end up being hospitalized, and a lot more people also die. Okay, so the next question, how does the virus enter the body? So think about which of these you would answer. Eyes, nose, mouth, skin, or all of the above. And the answer is only the eyes, nose, and mouth. So it does not enter through the skin. All right, how can you be exposed to the virus? Respiratory droplets, contaminated food, or touching contaminated surfaces? The answer is A and C, respiratory droplets and also touching contaminated surfaces. The problem isn't so much touching the surfaces, but then that if your hands have the virus on it and then you touch those three places where it can enter the eyes, nose, or mouth. Food transmission is not a main source of transmission. The next one, older people are most at risk to get the virus, true or false? So this is actually false because anyone can get the virus. It's just that older people are more likely to develop serious symptoms or even to die. And the other group that's at high risk are those with pre-existing conditions such as asthma, diabetes, heart disease, or any immune diseases. And so you can see in the chart here that the cases by age vary. However, it's the 75 and over, actually starting with 65 and over, that you see a lot more deaths. And then lastly, which of these are ways to protect yourself from getting the virus? So is it staying home as much as possible, staying 6 feet away from anyone who doesn't live with you, washing your hands, disinfecting surfaces, wearing a cloth mask, or all of the above? And the answer is actually all of them except wearing the cloth mask. So as you can see in the picture here, the reason that we're asked now to wear cloth masks is to protect others from our respiratory droplets. So if we cough or we sneeze, some of those bigger droplets will be contained by the mask, not all of them. The small ones actually go through normal cloth. So it doesn't actually protect the person wearing the mask because the virus particles can go through the mask and you can still breathe them in.
Okay, thank you for that, Alejandra. So now we are going to watch a quick clip um, of this video about coronavirus to get a better sense of this phrase that you may have heard, flattening the curve. So this video is really about how COVID-19 is spreading and why it's important for everyone to follow those measures that Alejandra just reviewed.
The coronavirus is often compared to the flu, but actually, it's much more dangerous. While the exact death rate is hard to pin down during an ongoing pandemic, we know for sure that it's much more contagious and spreads faster than the flu. There are two futures for a pandemic like corona: fast and slow. Which future we will see depends on how we all react to it in the early days of the outbreak. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst-case scenario for a fast pandemic begins with a very rapid rate of infection because there are no countermeasures in place to slow it down. Why is this so bad? In a fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare systems become unable to handle it. There aren't enough resources like medical staff or equipment like ventilators left to help everybody. People will die untreated. And as more healthcare workers get sick themselves, the capacity of healthcare systems falls even further. If this becomes the case, then horrible decisions will have to be made about who gets to live and who doesn't. The number of deaths rises significantly in such a scenario. To avoid this, the world, that means all of us, needs to do what it can to turn this into a slow pandemic. A pandemic is slowed down by the right responses, especially in the early phase, so that everyone who gets sick can get treatment and there's no crunch point with overwhelmed hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine. This simply means two things: not getting infected and not infecting others. Although it sounds trivial, the very best thing you can do is to wash your hands. Soap is actually a powerful tool. The coronavirus is encased in what is basically a layer of fat. Soap breaks that fat apart and leaves it unable to infect you. It also makes your hands slippery, and with the mechanical motions of washing, viruses are ripped away. To do it properly, wash your hands as if you've just cut up some jalapenos and want to put in your contacts next. The next thing is social distancing, which is not a nice experience, but a nice thing to do. This means no hugging, no handshakes. If you can stay at home to protect those who need to be out for society to function, from doctors to cashiers or police officers. You depend on all of them. They all depend on you to not get sick.
Okay, so that video does a good job of sort of just reviewing how this is a public health issue and how it really, everyone's actions are like really have an impact on other people. And especially, like they were saying at the end of the video, there are lots of people who don't have the option of staying home, right? So like we've been hearing a lot about essential workers. And so those are all of the folks that are keeping society running, right? So all of the people who are working at the grocery stores, the agricultural workers that are keeping all of our stores stocked with fresh fruits and vegetables, all the people who are working in the meat packing industries, right? So kind of, if you think about the whole supply chain, food, and then all the people who are involved in transportation to get that food to other folks, all the people who are working in hospitals, right? Who are at really high risk, the people who are working in like mortuaries, right? So, and are dealing with bodies of those who have died from coronavirus. So we know that there are lots of workers that are involved in these essential functions that are keeping society going even through the pandemic. And so in this next part, we're going to be talking about how workers can be exposed.
All right, so let's think about how this applies in the workplace. All right, so if you remember, right, the main mode of transmission are the respiratory droplets, right? So the number one way that you could be exposed in the workplace is other people. And this could be other coworkers. You know, sometimes you have to be in contact with other people, or you gather at certain times, maybe at the beginning of a shift to get supplies, or you take your breaks in the same place at the same time. So coworkers can be a source of infection. But then also, if you are in a workplace where you have clients or customers or the public, then you're exposed that way too. And obviously the more people and the closer they are, then the greater the risk. So for example, a cashier might be exposed to hundreds of people. And if there's no sneeze guard or, physical distance, then they're going to be very close to her. The second way is through work surfaces and supplies. So some of those droplets can land on certain surfaces that then get touched by other people. And so the more high traffic and high touch the surfaces, then the more risky it is. And so the picture here of the bathroom is here because even though respiratory droplets are the main mode of transmission, the virus has also been detected in feces. So that's something to keep in mind if that applies for your job. Some contact surfaces might be, if you're sharing supplies, or in here you see like, handing a credit card back and forth, or if you're punching in and out in the same area. And then also just getting to and from work could be a time where you could be exposed, especially if you rely on public transportation. Even though, in some modes of public transportation now they've instituted policies where there's more distancing and there's a lot more disinfecting, it's still the case that you could end up being in close contact with others, or, touching something that someone else has touched or sneezed or coughed on. And just a reminder too, that when a worker is exposed, then they come home and all the people that they're living with could then be exposed through them as well. So when you protect yourself as a worker, you're actually also protecting everyone that you come into contact with.
Great, thank you. So in this next part, we are going to be talking about intersectionality and worker health and safety. So it has come out in the last couple of weeks of the pandemic that there is really a disproportionate impact or an uneven impact on how people are dying and who is dying from COVID-19. So this is a graph that shows the extreme disproportionate impact that we're seeing, especially in Black communities in America. So we see the rate of death is it's more than double in the Black community. And then after the next most impacted group are Latinx folks, and then Asian folks, and then we can see that white communities are being the least impacted by deaths, and this is per 100,000 people. And this is as of May 11th, so it's really recent data. So now, Alejandra, can you tell us a little bit about why we might be seeing such different numbers in different communities when, especially we've been hearing, I think, a lot of people say like, oh, we're all in the same boat with COVID-19?
Yeah, that's a really good question. And I think there's a lot of factors, but if we were just to kind of summarize a few of them, we talked about before how people that have certain health conditions will be more at risk. And so these communities are ones that have been impacted by a lot of structural inequalities and racial inequalities in their access to healthy food. A lot of these communities live in places that are food deserts, and it's a lot harder. They are disproportionately represented in low-wage jobs where they may have to work really long shifts or have more than one job. And so it's very hard to have time for exercise and leisure and rest and things that keep us healthy. They're also more likely to have jobs that don't provide health insurance, and so they may not have access to quality care. And now they make up a large part of the essential workers, and so they are forced to go back to work, and often they're in circumstances that aren't protecting them, with employers that are not taking those precautions. But they don't have the choice not to work because they need the income, and also they will not qualify for unemployment if they refuse to go back to work and their work is open. And just one last thing to mention is that for many undocumented workers and many workers in kind of the informal economy, they're excluded from our health and our safety net anyway. So those are all some of the factors. We could talk a lot more about it.
Great, thank you so much. Yeah, I think that it's really helpful to think about just like how complex these issues are, because I think that COVID-19 has just sort of highlighted all of these other systemic inequities that we have in our society. And you touched on a bunch of different ones, the ways that people are tracked into certain jobs, the ways that certain jobs are more exploitive than others, right? If people aren't getting the sort of adequate health and safety protections at work, and they're being pushed to go to work faster, it, there are real tangible impacts to the systemic inequality, and we see that in these numbers. So now we're going to just watch a minute of this clip that is all about, it kind of defines what intersectionality is and where that term comes from.
Today we hear the call for full equality for women and distinctly for women of color from a multiplicity of perspectives. Intersectionality is a term we often hear, but what does it mean? Kimberly Crenshaw, who coined the term in 1989, explains it with a metaphor.
Consider an intersection made up of many roads. The roads are the structures of race, gender identity, class, sexuality, disability, and the traffic running through those roads are the practices and policies that discriminate against people. Now, if an accident happens, it can be caused by cars traveling from any number of directions, and sometimes from all of them. So if a Black woman is harmed because she is in an intersection, her injury could result from discrimination from any or all directions.
Intersectionality in all discussions of the rights of African American women today is built on the work of previous generations who have always been a part of the fight for full equality.
Okay, great. Okay, so I really like that video clip because I think it is a really helpful way to think about intersectionality, right? That there isn't one dimension or one road that any of us are on. We all kind of are showing up to any situation with all of these different kind of aspects of our identity, and those different aspects of our identity have an impact on the way that kind of the options that we have in leading healthy lives and our ability to do so. So a lot of times when people think about, like in the reporting on COVID-19, for example, when the fact of this disproportionate impact on communities of color comes up, then some media outlets use that as an opportunity to blame those communities for the health impacts that they're experiencing. And so we talk about comorbidities, or people who might already have asthma, or they might have heart disease, or decreased lung function, or they might be obese, right? Any of these other things. And that is a very narrow way to sort of be looking at what's really a public health issue. And it really ignores all of the systemic reasons why certain communities have been left out of and pushed out of systems that allow other communities to be healthy. So Alejandra gave the example of food deserts, right? And how if people of color are being tracked into jobs that don't pay well, and they're having to work multiple jobs, and then they don't have the ability to rest or go to the doctor, they might not have health insurance, right? All these other things. So intersectionality is a really good way to sort of deconstruct all these different aspects that can feel like really complex when we're thinking about why we're in the situation that we are, where things are not being equally kind of spread out across different communities. So this is a quick fun guide to intersectionality. And so I'll just kind of read through this cartoon here. So there is a stripy triangle whose name is Bob, and he says, hi. Bob is a stripy blue triangle and should be proud. Sadly, some people do not like Bob. Bob faces oppression for being a triangle and for having stripes. So then you see two different groups here. One says down with stripes, and then the other one says God hates triangles. And then you see Bob has a sad face on in the middle of these two groups. And then it says, luckily there are liberation groups, but they aren't intersectional. So they look like this. And you see one box says welcome triangles, and then the other box says welcome stripes. And the next thing says they don't like to talk to each other. In fact, they compete. And then Bob says, that he can't work out where to go. And so he's thinking, am I more stripe or more triangle? Bob wishes that the triangles and stripes could work together. And then we see a stripy circle that says oppression of one affects us all. And then we see a triangle without stripes that says no liberation without equal representation. Intersectionality is the belief that oppressions are interlinked and cannot be solved alone. Oppressions are not isolated. Intersectionality now. Okay, so intersectionality is a really helpful tool and sort of lens that can be applied to lots of different issues. So in this session, we're talking about occupational health and safety, but there are lots of other examples where this might be the case, right? So if maybe you've had this experience where you're involved in a community group or a religious group and you really enjoy being there, but you don't feel like you can talk about your sexual orientation there, or you don't feel like you can kind of be your full self because the group that you're a part of is really only interested in one segment of your life, right? So like if you are involved in a labor group, but you don't feel like they are they're kind of cognizant or aware of how gender is impacting labor in that situation. Or this can kind of be applied to lots of different situations. And if you sort of take the stance that intersectionality is important because impressions are interlinked and you can't solve one issue without sort of taking into account all of these other issues, then it becomes much easier to sort of show up as our full selves and be working towards justice and liberation for everyone. So now here is an example about wages. So we see here that compared to white men on average, African-American and Hispanic women, it says here, make even less than white women. So you've heard the statistic that on average for every dollar that a white man makes, a white woman would make 77 cents to that dollar. But then if we break that down into Black women or Latino women, Latinx folks, we see that that number gets even smaller. And so this again is an example of why intersectionality is important, because we see that there is this difference, and these are folks that are doing the same work, but the work is being valued differently, and that can be applied in the same way to occupational health and safety, right? That there might be differences in the way that policies are being enacted based on a person's race or gender, or any of these other issues like ability. Okay, and then here's a great quote from Audre Lorde: "There's no such thing as a single issue struggle because we do not live single issue lives." So what we're gonna do next is go through a role play. We're gonna look at two young people, Rochelle and Cole, and each of them has an issue at work. So we're going to hear about what's going on with them and then talk about what they might be able to do based on both their challenges and their resources based on kind of who they are in terms of like an intersectional lens. So our first story is Rochelle's story. Alejandra is going to read that for us.
All right, so I'm going to read you Rochelle's story. Rochelle is dark-skinned and lives in a working-class neighborhood in Oakland. Her parents immigrated from Haiti, seeking asylum after the earthquake there. They speak French Creole and limited English and have a grade school education. Rochelle is in high school and is working at a fast food restaurant to help her family economically. It's her first job. She chose it because there are not many other jobs she can get to on the bus without going too far from home. And they were willing to take her with no previous experience. Rochelle is a member of her church choir and school government, and also likes to sell homemade bracelets online through a friend's business. One day, while Rochelle is at work, she burns her hand. Her supervisor tells her that it's not serious and she should keep working. The supervisor says, "You know I don't like it when people complain and lose work time." When Rochelle goes home, her mom, who is a home health aide, applies a home remedy. Even though both of her parents work more than one job, the family does not have health insurance. Rochelle's burn still stings the next day, but she is not sure what else to do. So let's reflect a little bit on what's happening in the story. So Rochelle had an incident in her workplace, and her supervisor did not respond in a way that would keep her safe. So Yassine, what do you think that Rochelle's supervisor should have done?
Sure. So her supervisor should have helped her connect her to medical attention, and that would be paid for by workers' compensation. Her supervisor should have let her know that she doesn't need to finish the shift, or that like her health is the most important thing. And so she doesn't need to come back into work until she's healed. And so after, if she had to take time off to handle her burn, then after 3 days, that could be paid for by workers' compensation as well. Something that's really important that the supervisor should do is find out what happened to that led to Rochelle being burned, to figure out how to prevent that in the future. And so that could look like fixing equipment if there was something that was broken that caused the burn, or if Rochelle was having to work really, really fast because there weren't enough people and so she didn't have time, and was just kind of really like stressed and flustered to try and get all of the work done because of understaffing, then the solution could be to have more people on at that time, or to provide protective equipment like having gloves that would be resistant to heat and fire to prevent the burn. So those are a couple ideas about what her supervisor should have done.
Those are great ideas. And, you know, something else that stood out to me in the scenario is that the employer said, you know, I don't like it when people complain. And it's something we hear a lot from workers, that they definitely get the message loud and clear from their employers that they're not supposed to speak up when something is unsafe, and they're not supposed to speak up when they get hurt or ill. And so, you know, that's actually one of the rights that workers have, is to be able to report injuries or report hazards without retaliation. So without any fear that they're going to be punished for it. Whether it's fired or anything that is, you know, kind of an adverse action, something that they wouldn't want to happen. But it sounds like, you know, Rochelle was under a lot of constraints. She was facing a lot of challenges. She also had some resources available to her. So let's start with the challenges. What challenges do you think that Rochelle was facing?
Sure. So the fact that her parents are new to this country, right, that they might not know about workers' rights here. They also have limited English skills and potentially literacy, and so it might be difficult for them to access resources about workers' rights. There is also a note that Rochelle needs money from her job to help her family, so there might be some kind of tension or difficulty there about leaving the job, or feeling like she could speak up to her supervisor when the supervisor said that thing about, you know, I don't like when people are complaining about work. There was also a note about Rochelle's lack of options for other jobs because of both transportation and lack of experience because of her age. And that's something that I think is really important to just point out, is something that with young workers, we see this all the time, that young workers are really eager to like show that they are able and willing and ready to do a really good job. And that can sometimes have the unintended consequence of making it difficult for them to like speak up and kind of advocate for their rights when something does go wrong in the workplace. Kind of going along with that, this was also her first job, so she probably doesn't have a lot of experience with what to do when something goes wrong, and sort of how to speak up. And something that could be really helpful with that is training on the job, but we're not told kind of in this scenario whether or not she's even received any kind of training.
Yeah, that's true. And she probably doesn't know a lot about her rights as well. And so the supervisor is taking advantage of that. And the fact that he probably thinks that he can replace her easily, as you said. And to link it back to what you were explaining about intersectionality, right? She may be facing discrimination in her hiring or how she's treated because of her dark skin, because of her immigrant parents, or even her economic status. We don't know in this case, right? But those are all possibilities. They're all part of what she's bringing to work.
Right.
So she also has, I feel like she has a lot of challenges, and yet she also has a lot of resources available to her. What do you see as some resources that she has?
Absolutely. So one resource that I think is really great is that she has access to education and resources through her school. There was a note about how she has developed leadership skills already through her school government. And so we know that she is kind of already active. We know that she has access to resource and support through her church. There was mention of her doing some online business, so we can assume that she is computer literate and internet savvy, and that she also has she's already found and sort of been cultivating another way for her to earn money through the sales of her online bracelets.
Yeah, I think that's so important to think about, that for all of us, we'll have things that are challenging for us, but we'll also have sources of strength and support that we can draw on.
Exactly.
So should we go to our other case study?
Yeah, definitely. Okay, so now let's go to Cole's case study. Okay, so Cole was born and raised in an upper middle class neighborhood in San Francisco. His dad is a tech worker and his mom is an attorney. Cole got an internship in an app development startup through a friend of his dad's. And Cole hopes that this experience will help him get into the same elite college that his mom attended. And he doesn't get paid very much, but his family doesn't need the money. Cole enjoys swimming and playing video games. He's even learned how to code himself. Cole also recently came out as gay. One day, while Cole is at his internship, a coworker gets really angry about something that went wrong and yells at Cole, insulting him for his sexual orientation. His supervisor sees what happens, but just tells the person to calm down and walks away. Cole feels angry and hurt and uncomfortable about having to continue to work with this person. When he gets home, his mom tells him that he should talk to his supervisor, and his dad tells him not to take it seriously. Cole is anxious about going back, but also doesn't want to miss out on the opportunity of working at the startup and isn't sure what to do. Okay, so now we're going to go through those same reflection questions. So, Alejandro, what do you think Cole's supervisor should have done?
Well, it sounds like even just in the moment, the supervisor should have intervened in the situation to ask that coworker to stop the yelling and the harassment, and to check in with both parties. First, to make sure Cole is okay, to let him know that this should not be tolerated in the workplace, and what the plan is so that it won't happen again. Maybe there's a way to put Cole in another part of the business so that he doesn't have to deal with this person, because it's obviously not safe, so that he could be reassigned. And then for the person who was doing the harassment, hopefully there's a policy in the workplace that doesn't allow this, and so the person needs to know, and they need to know that there will be a consequence if it happens again.
Right, absolutely. All of those are really important steps that could be taken. And I think another step about kind of knowing what should be done, and to make sure that everyone understands that sexual harassment and bullying are not allowed in workplaces, right? And so one way to do that would be to make sure that there is a workplace training on illegal and inappropriate sexual harassment and bullying, and to have a policy that works to address it, and make sure everyone knows what that policy is, including a way to report incidents when they happen, so you don't end up in a situation like Cole's in, where something really uncomfortable happened and then there's just kind of no recourse. So what challenges do you think Cole might be facing?
Well, it sounds like the scenario said that he recently came out as gay, and so he's probably not very prepared for people insulting him based on his sexual orientation. And I'm guessing even less in a workplace context, and especially by an adult who has, power over him. So I'm sure that must be a really, really tough situation for him that he doesn't have a lot of experience in navigating. And I'm guessing too that he doesn't know what his rights are, that like you said, there doesn't seem to have been much training in this workplace. And so he may not know, like, is this okay? Is there some law against this? Can I talk to anyone about it? How do you enforce, your right to be in a safe workplace? And then I'm guessing too, he feels some pressure. He's trying to get into this elite college, and this internship could provide him a good experience on his resume. So even though he doesn't really need the money in the same way that Rochelle did, there is something in it for him. In fact, it could be really awkward since he got this internship through his dad's friend, that, if he were to leave it or to be on bad terms, that, would reflect badly on kind of the family connection. So he's still invested, even though it's not, necessarily for the money.
Right, absolutely. And I think we maybe got a hint of that in his dad saying, like, oh, don't make a big deal about it, right? It's kind of furthering that idea that maybe the dad, kind of doesn't want to make anything awkward between maybe himself and the friend who got Cole that job. Right, so just like we talked about with Rochelle, Cole also has resources. So what are some of the resources that sort of come to mind for you when you heard about Cole's story?
Yeah, well, one thing is, it sounds like his parents, are highly educated, and they have access to professional and financial resources, connections, including, this job opportunity. And he doesn't really need the money, in the same way that Rochelle's family needed her to supplement the family income. And so that pressure is off. And I'm guessing Cole has a good chance of getting into a good college, based on what we heard so far. So he's prepared in a lot of ways. The fact that he knows how to code, that's like a very, marketable skill. And just to link it back one more time to the intersectionality, it's less likely that he'll be discriminated against for his skin color, being white, or his economic status, which is, middle upper class. Though there is the issue, though, of his sexual orientation, that it's something that he might fear would be a source of discrimination in future employment.
Right, absolutely. So I think that this is a really good, it's a really nice kind of comparison, right? Because here we have these two young workers that are working in really different industries. They're coming from very different backgrounds. They both have an issue at work, and they both have challenges, but also resources to turn to and kind of rely on for ways to move forward. So I think this is like a helpful frame for us as we move forward and continue to talk about occupational health and safety with kind of this intersectional lens, right? Because the resources that I bring to a workplace and the challenges that I have are going to be different, most likely, than some of my colleagues and my coworkers, right? And so that can create an opportunity for us also to come together and work collectively. If I have a resource of, like, say, if my mom had the sort of medical knowledge that Michelle's mother had, then maybe I could support a coworker who was sort of like needed help in that area. Or if I have a coworker who's more like Cole and is maybe white and not as dependent on the like financial gain of working at the fast food restaurant with Rochelle, then maybe that person can come with me, or that person can be the one who like raises health and safety issues on the whole, or kind of is the speaker for other folks who don't have that kind of privilege. So once we're thinking in an intersectional way, then we can sort of make strategic decisions about how we can support each other and our coworkers and our friends to make the situation healthier and safer for everyone. Okay, so the last thing that we want to talk about here is just to bring it back to young workers again. So at the beginning, we mentioned that young workers are almost twice as likely to be injured at work than workers who are older than 25. And most of these injuries can be prevented if teachers, parents, employers, teens, and others work together to be aware of what like what hazards are, what's likely to hurt people, and how to address those hazards, to understand the rights and responsibilities that workers have, and also to know how to solve problems in the workplace. So those 4 skills are what we call the occupational safety and health critical thinking skills. And these are not just skills that are applicable to workplace health and safety, they're applicable to lots and lots of different kinds of advocacy, and kind of any time that you might want to make a change in something, these are really helpful steps to go through. So in the next part, in part 2, we are going to talk a lot more about each of these steps. So we're going to start out with defining what a hazard is, and then going through how do you recognize hazards in different industries, how to address those different hazards, what workers' rights and responsibilities are, and then how to effectively solve problems in the workplace. Okay, so that is the end of part 1, and please do tune in for part 2.
Thank you, everyone.
Thank you.